Hi, I'm Dr. Kathleen Janelle. I have been using a natural treatment called high-dose sulfur to treat my patients who have abdominal symptoms for over 25 years, and it's a very successful treatment to take care of the problems of gassiness, bloating, abdominal pain, lots of burping, lots of gassiness. It works at least 95% of the time to get rid of these symptoms, and it's natural and it's easy. So I'm going to talk you through this process a little bit, give you some examples of cases that I've treated and how they've responded, and talk a little bit about why this treatment is important, what it's doing, and also how you can treat yourself at home to get better from these annoying abdominal symptoms. Usually they're diagnosed as something like an irritable bowel syndrome, or people are told they have small intestinal bacterial overgrowth or some kind of other bacterial overgrowth in their system. Oftentimes the people that I've seen have gone through extensive treatments to alleviate these symptoms, and yet they're still symptomatic regardless of what kind of treatments, antibiotics, antifungals, or diet changes that they've pursued. So we'll go through this, and we'll talk about how to naturally resolve these symptoms for good. This natural treatment is a high-dose sulfur treatment that's used to eliminate gassiness, bloating, and the associated abdominal pain that occurs with a gassy, bloating condition. I've been in digestive medicine practice now for over 25 years, and I've used the treatment that we're going to talk about, the high-dose sulfur, on thousands of patients, both in the US and around the world, to permanently alleviate the symptoms of gassiness, bloating, and abdominal pain. A lot of these people come in after failing treatment, using diet changes, using antibiotics that have been prescribed for either their small intestinal bacterial overgrowth, SIBO, or irritable bowel syndrome, IBS. So I've treated thousands of patients using this high-dose sulfur protocol, and I see a lot of patients who have failed treatments using antibiotics like Xifaxan or rifaximin, erythromycin, metronidazole, or herbal treatments. The number of times I've actually used those types of treatments are a handful, probably less than 3 over the course of 25 years. So everyone else that I've seen who's been diagnosed with SIBO or irritable bowel syndrome and has these gassy, bloaty symptoms and abdominal pain, I've used a high-dose sulfur treatment to take care of these symptoms and eliminate them permanently. And what I mean about eliminating the symptoms is eliminating the symptoms. The symptoms are gone. The diet is opened back up into a diet where you can eat whatever you want to eat with very few restrictions without getting symptoms. So it's a permanent resolution. The symptoms they don't return. Here's a map of some of the areas that I've treated patients using this high-dose sulfur treatment around the country and in other places around the world. So right off the bat, I'll talk you through a case study. And this case is a 30-year-old female student who had painful bloating that started every day after noon. After around noon, suddenly her digestive system would just slow down, and her stomach would bloat up. It was painful, it was cramping, and nothing really took it away until she went to sleep and woke up the next morning and started that cycle again. Now this is regardless of what she ate, what she didn't eat. Even just having water in the morning would stimulate this and start it to happen. And she was very experimental person, and she was in medical school, so she tried lots of things. She saw a naturopathic physician, and she did diet changes, tried lots of different diets and eliminations. She took antibacterial, antimicrobial treatments and antifungal treatments that were both natural and that were prescription. She took some digestive support in terms of pancreatic enzymes and hydrochloric acid and gallbladder support. So really she had basically exhausted most of the possibilities in terms of how to solve this problem. Nothing really touched it. Nothing really changed her symptoms until 10 years into it, she started doing the high-dose sulfur treatment. She took the high-dose sulfur for 8 weeks and then stopped and went on a maintenance program with it, and her symptoms resolved during the course of that 8-week time, and they have never returned. That was over 20 years ago, and that person was me. This treatment that I'm talking about, the high-dose sulfur, a lot of the research behind it comes from Dr. Stephanie Seneff, who's an MIT research scientist who's focused a lot of her studies on the link between glyphosate, which is Roundup, it's a pesticide, and sulfur. So what she feels, and what I also feel based on my clinical practice, is that this glyphosate is affecting or impacting the soil microbiome, and in doing so is decreasing the amount of sulfur that's being incorporated into plants as they're growing. It also impacts our human microbiome. 50% of our human microbiome is sensitive to glyphosate, so when it gets exposed to that from foods that have been sprayed with that, then we're killing our microbiome and lowering the diversity, and that's leading to a sulfur deficiency, which I'll get more into as we go along. In fact, Dr. Seneff is the proponent of this piece of information that's very critical to what we'll be talking about with the high-dose sulfur treatment, that sulfur is the most common nutrient deficiency that you've never heard of. So now we're going to talk about it so that you can hear about it. I'm going to continue this presentation in part 2, and we'll talk about some of the inaccuracies of the diagnostic tests that are available currently for diagnosing small intestinal bacterial overgrowth, SIBO, and irritable bowel syndrome.